Are we starting?
You can start, if everybody has cell phones, if you could turn them down to at least the ringer off on buzzer, because it'll come through the mics. And it picks up talking in the audience, so if you could watch this presentation and then talk on.
And I hope you guys can see me. I am short, so this is a little high. Okay, I'm going to start here. My name is Mai Wen. I was asked today to present on leading a sustainable nonprofit in the age of volatility, uncertainty, complexity, and ambiguity. And also share something a little bit about myself. Who is Mai Wen? This is kind of a collage, a picture of representation of things that are important to me. I am a refugee from Vietnam. I came here by boat when I was 5. I am the 3rd oldest kid out of 9 children. I have 4 brothers and 4 sisters. I think that experience helped me mitigate and deal with negotiation really well in that family dynamic. I'm a product of public housing and public school. I believe in it, I think it works, and I'm proud of it. I graduated from the University of Washington, earning a bachelor's degree in political science and a master in public administration. I started my career as a community organizer, really, in the International District, working on housing issues, public safety, and senior and disabled issues in the International District. I became the executive director of International District Housing Alliance at the age of 23. That is so long ago. I have spent the last 20 years working in public agencies and nonprofits, focusing on issues of health, homelessness, public safety, workforce, asset development, senior and disabled family issues, and children. I've done it all in terms of issues around the community. I currently sit on 2 boards. Well, I've sat on the board, but now I'm actually, when you sit on a board, you never really leave the board. You kind of keep getting asked to do stuff. But 3 organizations I continue to volunteer for is the Asian Community Leadership Foundation. I was president for several years, Denise Louis Education Center. I am the current fundraising chair. And the Wing Luke Asian Museum. I currently volunteer for them also. But in my past life, I was president for several years with the Minority Executive Directors Coalition. So I know the issues that's facing nonprofits today. I currently live with my husband, who is an ADS case manager. So I know the issue from the ground every day. I've done dig outs. I've gone and picked up stuff, meals, you name it, we've done it. I have 3 wonderful kids, and I have a mother-in-law who's 70 that lives with me. So I understand the whole issue of aging in place, and aging issues. So, faced with the question of how do you lead a nonprofit in this time? So, my answer is really, my focus for senior services is to have a clear vision. If I was the leader of senior services, this would be my vision for senior services. 1, the increased visibility of senior service of Seattle-King County throughout the state of Washington. I think the challenge for senior services is a lot of people see it as tied to a government entity. They don't necessarily see it as a nonprofit standing alone. So increasing that visibility out there that we are a nonprofit, we're doing great work in the community. Demonstrate, I'm just looking back, sorry, just to make sure it's popping up. Demonstrate to external entities that we have an excellent system in place to identify and actively manage risks and be good stewards of public resources. That is very key for funders. 3rd is show strong program results. We need to demonstrate to our community, to our funders, that we have excellent programs and we have excellent results. We need to tell our stories. And lastly, be a strong advocate for senior issues. That's my vision for senior services. How are we going to do this? These are my key assumptions, my key working assumptions across the board as I move forward in the slides. Respect, making sure we respect each other, respect the work, respect the people we're serving. Cultural competency, and I would say also diversity. That is key to the work that we're doing. It is a changing community. The demographic shift of the aging population is tremendous, and communities of color are growing at a faster rate and pace. We need to be able to make sure we meet the demands and needs of those communities. Partnership. Partnership is key to our work. We can't do this alone. There are some really great organizations out there that we should be partnering with if we're not, but if we are, build stronger alliance with them. And lastly, evaluation. This is the part where everyone goes, ugh. And I said it is important. Evaluate what we're doing. Ask, are we doing it well? How well are we doing? And are we getting the results we need? Evaluation is key. It tells our story. What will it look like for senior services? Oh, hold on. One, in terms of the areas of focus, how are we going to move ourselves? The areas of focus for me is, one, what are we good at? Work with the board staff and key stakeholders to focus on our core businesses. Nonprofits, many today, chase after funds, or what we call mission creep. Oh, we should apply for that money because now we could do this and save the program. We start building this elaborate scheme or ideas to seek funding. Remember that growth is not always good. Added revenue means added expenses. Support what really works rather than just new or innovative approaches. We should say no to funding opportunities or programs that do not align with our mission. But we should say yes to opportunities that will take our mission to the next level. The outcomes will be clear directions of investments, opportunity as we're examining this for a partnership, and lastly, demonstrated results. Through focusing on our core business, we could do that. The next area of focus for me that is important in this work is financial accountability and transparency. Show return on our investments. Boards, government, foundation, general publics, questioning nonprofit works every day in terms of our expenses and how we're spending it. They're calling for transparency. Stakeholders want to see good being done in the community through efficient and cost-effective means. System of controls in place to manage the risks. The thing that I love most is showing our expense ratio, low expense ratio. Figuring out how we can get there. What would that mean for senior services? What is the expense ratio we want to be at? The outcomes of this would be good stewards of public funds, increased funding for the organization. Technology. Oh, technology is ever growing pace, and it's demand, and it's hard to keep up. So just this morning trying to figure this out is already a challenge. But the thought here is use technology to maximize efficiency within programs, administrative tasks, and communications. Software exists that can help you manage online donations and fundraising, event and conference management, volunteer coordination, reporting functionalities, e-commerce if we have it, bulk mailing and newsletters, as well as provide a community in which to connect. It's very important because the outcomes essentially is to reduce program costs. Looking at ways to make it more efficient so we can reduce program costs. Increase revenue. If you have an online donation, press button. One of the things I went on Senior Services website, first thing I said from the fundraising world, Coleman, there is not a donate button right at the beginning. There needs to be a donate button right there somewhere. So if people are visiting our website, they see it. They see it. Most nonprofit is about raising money to continue the good work that we do. And lastly, increase visibility. Using technology to increase our visibility in the community, especially for the community that we're serving. King County is wide and big, and I think we need to look at that. The next one is human resources. This is key. Attract and retain talented workforce. It's a key to our success. It is who senior services is. It's who you guys in this room are in terms of senior services. Without the folks in this room, we wouldn't be able to do what we do. We need to have clear roles and responsibility of all staff, provide training to staff, identify conflict if it exists, have performance measures and outcomes, and evaluation of staff. What does that mean for us in terms of outcomes? Cost savings from low turnover. We'll have high staff morale. We'll have high performing staff. And clear accountability. It's always nice to know what is expected, what are your measurements in terms of what you're doing, and being able to have that conversation so everybody feels good about themselves in terms of the work that we're doing and where we're standing. The next piece of focus for me would be board development, strengthening the board. Making sure the board is diverse, and I mean diverse in terms of community representations, but also skill sets. Making sure we have board members, I'm sorry, it just talks about it up. Making sure that we have diversity on all levels, skill sets to community representation. A strong board of directors increase public awareness for the organization that they serve by utilizing their influence to connect others in their network of contacts to the organization. So it's very important. I see the role of boards is helping us be strategic, connecting us to communities and partners, and also setting policy and guidelines for the organizations. They are or should be, to many levels, the face of the organization in our community. What happens when we have a very strong board? We increase community awareness and visibility of the organization. We have access to new donors and volunteers, assuming that those board members will help us bridge things. We have an open door to new opportunities. They could be at churches, they could be in certain business or community that we don't have current access to. Figuring out how to tap those board members and their skill sets and what they could do for us. They also, essentially, are a board of fundraiser. Increase raising money. Oh, sorry. This is going faster than I. Increase people raising money for the organization. So they are out there with the executive directors and staff and volunteer raising funds for the organizations. They are essentially our eyes and ears for the organization and creating opportunities for us. The next slide is fundraising. You see my lovely fundraising? I love this part, but I'm just kidding. Raise the money. Because that is what most executive directors spend a lot of their time on. It's either human resources, board development, or fundraising. So, but fundraising is key in this position. It's key for nonprofits. We need to strengthen existing revenue. Look at our senior centers. Look at our events. Look at what we're doing in terms of programs and program fees at those centers and our events, and figuring out if there's a way we can work it to look at new line stream of revenue for those folks, or for the center, I'm sorry. Second is to create a new revenue stream. Look at co-branding. One of the things I learned from Cohen, my experience over at Cohen, is we do a good job of co-branding. Senior services can look at it in a different way in terms of co-branding with products, services, you name it. And it has, and I want to emphasize, align with our mission. It can't be, oh, this is going to generate millions of dollars for us, we should definitely do it. No, does it meet the need and the mission of what we're talking about here? And if the two align, what is it that we give up in terms of branding? What does that mean? What are the risk factors? So look at that. Third-party events. I don't know if you guys understand what third-party, but I'll explain. Having other people doing events for senior services. We're the beneficiary. We don't do any work. These are ideas with added no additional staff or resources. But the thought is third-party events, whether it's for senior service or if it's a senior center, working with the communities and having them support us through that way. Major asks. Major asks is big. Looking at our existing donors, figuring out who is on our donor roll right now, working with them and asking them to increase their ask. Also figuring out who potentially would donate to senior services that would be interested and start cultivating. Because a lot of nonprofits spend a lot of their time on events. Events, events, events. Really the easy ask. And the less administrative cost is fundraising by individual asks. It really is the way to go. It's a proven fact for nonprofit in terms of being sustainable. And corporate sponsorships. Increase our corporate relations, corporate sponsorship in the community. The outcome pretty straightforward. Increase revenue. We want to increase revenue for the program and the work that we're doing. We want to continue funding the good projects that we have. The other aspect of, in terms of corporate relationship, I want to say is that identify corporate company where a lot of seniors work. Weyerhaeuser, I found out through research, has 37% of their workforce make up of senior adults. What's our relationship to Weyerhaeuser? It's in Federal Way, it's locally here. So just a thought of some of those things that we need to look at. Advocacy. Inject the needs, values, and contribution of seniors at the federal, state, and local government. Outcome, be the voice for senior issues. Greater visibility for senior services. I think senior services needs to play an important role in advocacy. A large percentage of our funding comes from state level feds. We have to have a presence there. We need to move that needle. We need to move that agenda and make sure that those resources come back to senior services. Closing. Sorry. Why me? Why me? Well, let's see here. I think for anyone to lead a nonprofit this side in this challenging time, you need a strong leader. A strong leader that's passionate, access and quality for all is what I believe in, who's experienced. I have over 20 years of experience in a senior level position in nonprofit, who's committed, involving. You have to ask everybody in my household and any friends, anybody who comes to me. I am committed. Once I'm committed, I involve you. That's just how it goes. You can't say no to me. First thing they can say is no to me. I'm driven. Driven to serve the community, to seek justice, to change policy, to ensure that everyone has a voice at the table. So in closing, I'm going to read a poem that I think represents who I am and what I am. At the core, if you didn't get any of this, this is it. It's called It Couldn't Be Done by Edgar Albert Guest. Somebody said that it couldn't be done, but he with a chuckle replied that maybe it couldn't, but he would be one who wouldn't say so till he tried. So he buckled right in with the trace of a grin, oh, his face. If he worried he did, he started to sing as he tackled the thing that couldn't be done, and he did. Somebody scoffed, oh, you'll never do that. At least no one ever has done it. But he took off his coat, and he took off his hat, and the first thing we knew, he'd begun it with a lift of his chin and a bit of a grin. Without any doubting or credulity, he started to sing as he tackled the thing that couldn't be done. He did it. There are thousands to tell you it cannot be done. There are thousands of prophecies failure. There are thousands to point out to you one by one, that dangers that await to assail you. But just buckled in with a bit of a grin, just take off your coat and go to it. So start in to sing as you tackle the thing that cannot be done, and you'll do it. Thank you. Now it's your turn to do Q&A, I guess, right?
Exactly.
Any questions?
If we have questions, if you would just open that and speak to the microphone so we can hear your questions this time.
Thank you, May, for a really good presentation. In your experience in running a community agency, what's the largest financial budget you've ever dealt with and the number of staff?
Well, let's see here. From a nonprofit standpoint, oh gosh, I would say roughly 20, a little bit over 8 million. From a public entity, in terms of my responsibility, about 50 staff over about, gosh, 20 million?
It was a very nice presentation, Nate. As you've looked at senior services as an outsider, what are some of these programs that you see are very strong? Where do you see a need for programs?
Oh, great question. I think senior services does an amazing job on Meals on Wheels, INR, and partnership with the senior centers in terms of program out there. In terms of opportunities that I see that is facing the aging population that we need to focus area of attention around would be workforce. More seniors are having to stay in the workforce. They're not retiring at 65. It's going to change. And so how do we become an advocate in terms of corporations, health benefits, services, those key components. The other piece is, we talk about aging in place. With my housing background, we used to be like, build senior housing, create communities. Now the thinking is, I think it's 1 in 4, 1 in 5 will be age 60 and over here in our community across the country. It's the largest population. So the notion for me is figuring how to make sure we integrate senior issues in communities. It's not about moving people, it's about keeping people in place. And how do they become support, valued, see as not a burden in our system, but as a person who can give, who has wealth and knowledge, who could share the lessons learned, and be able to be integrated into the community. And then healthcare. Healthcare is another piece. I know that we do it from just listening to what is provided here, but really be an advocate in the healthcare arena. Figure out what the needs are, what the issues are, and putting those things in place in terms of policy that's going to support the work that we do here. So those are kind of the areas I think could use more robust thinking around, more emphasis, but I think it's because the demand will come, and we're going to need to shift in that way.
Good morning. Is it Mai or May?
Mai.
Mai. Okay.
Mai, may I go by it?
Very good presentation.
Thank you.
So, Mai, if you become our next CEO, what do you feel would be your agenda for the first 90 days, for the first 3 months?
I really believe in going into any organization is understanding the work and culture of that organization. So spending time with staff, getting to know staff, what works, what doesn't work, internally first. And then really going outside and meeting key stakeholders. I want to know, in running an organization, what are the bad, the good, the ugly, going first. Because you'll hear it in the community. That's the thing. And be able to address those issues and concern right away, not go, oh, yes, we hear you, but not say, or address those issues out in the community, because our communities will not take that. They want answers. And so for me, the first 90 days, really understanding the inner working of senior services and understanding our challenges. Because, what works great, and I can celebrate with you and say, gosh, this worked great, but it's also the challenges in the work and figuring out what are some of the ideas that are percolating and are there opportunities that we could seek and move in those directions. So.
Good morning.
Good morning.
It was a good presentation.
Thank you.
You did mention cultural competence, and you yourself are a minority. So in your 20 years of this experience, I'm sure you might have come across different types of people, some very challenging, some very difficult to deal with. Could you give us a couple of examples of difficult situations and how you handle them?
Yes, definitely. Well, I worked in public housing for, probably 8-9 years. Public housing is probably the hardest place to work in terms of working with residents. I was in the resident services department. So you work with resident councils, neighborhood groups, you name it. When we're working in a development of a community, we're having a lot of community conversations. And I'll use one particular example. At Center Park, which is a building out in South Seattle. And I was the staff who had to create the first assistive technology center. First one in the state of Washington. We worked with residents who are senior and disabled, and physically disabled. It's, we have meetings with some of our residents in beds, they're rolling up in beds. It's just a very different dynamics. Overlaying that are languages. It's not just disabilities, age, it is also about language. We had probably, 15 different languages spoken in that room. And so understanding cultural dynamics, their issues and their concerns, and being able to communicate effectively is very important to those communities. And at times, for me, they pushed. They want this, certain communities will want this, and certain communities will say nothing. And being able to figure out how to talk to those communities so that we know they want something. We know they have needs, but in a public forum, they're not saying it. And so figuring out, pulling residents aside and saying, and having conversations with them about, what are your thoughts on this? How do you feel about this? And that's very important for the work that we do. But I would say I've been in so many situations in dealing with a number of issues in the communities. We live in a very diverse community here in Seattle, King County. It's probably one of the most diverse anywhere in the country. And so for me, I don't speak the language. I speak Vietnamese and English. My mother-in-law speaks Chinese. My kids speak Spanish. So, it's pretty, we have a world of languages in our house, but, we have over probably 30 languages in our community easily. It's figuring out how to work and communicate with those individuals. Figuring out, are there leaders in those communities we can work with that can help us navigate those community conversations and get their support and buy-in on the work that we're doing. But also respecting people. There are going to be differences. We're just going to have to respect and respectfully disagree on some of the things we're going to work on. So I don't know if that answers your question, but I have tons and tons of experiences in terms of working in communities of color, communities that don't speak English, extensive experiences.
Hello, Mike. Thanks for your enthusiastic and personal presentation.
Thanks.
I have a sort of two-part question.
Okay.
You've been at public service for 20 years. So as you look at this opportunity, what really attracts you from a career standpoint, from a public service standpoint? What really stands out for you about this opportunity to lead senior services? And the second part of that is, what concerns you about this role? What aspect of your background do you feel is going to need some bolstering or some extra help in order for you to be successful?
Well, the excitement for me really is the breadth and depth, the level of breadth and depth you can take senior issues. That really excites me. I've been for the last 5 years, actually a lot of my careers, the last 5 years I've been focused on breast cancer. It's very direct, very focused in terms of the issues. Senior issues is so broad and so complex that we could just go about any directions, anywhere. And the excitement really is the fact that it is a growing population. It is a growing population that we have to address on some level in a public policy forum. Transportation, housing, there's a number of issues. It's not just gonna go away, it's a huge demand that we're gonna need, and no one's addressing it really. It's an afterthought. So that excites me. In terms of the challenges of working in this arena is, again, the vastness of the program and being able to narrow it down and focusing our attention on the key work that we need so that we can show results and deliverable. And so I'm looking to the staff and the team I work with to help me navigate that. I can't do it alone. I don't know all the answers, but I certainly know that there are folks like yourself in the room who are going to help me. I'm going to ask for guidance and support and help. And that's what I'm looking forward to.
Good morning, Mike.
Good morning.
So my question is regarding what you see senior services role in both the age wave and the opportunities and challenges related to the Affordable Care Act.
Gosh. That's a very specific question. I think the Affordable Care Act has so many complexity to it. I mean, even in Coleman right now, we're trying to understand what the implementation will be for the community. And I know talking to several insurance companies, because I just did a whole entire health benefit census and reviewing that, and talking to those in the arena about implementing it. The challenge for insurance company that we have to keep them tasks for me personally is making sure they're not what I call pocketing people and providing less services so that they'll end up making more money out of us. It's really providing great quality care and giving people options and figure out the breadth and depth of it. And a lot of insurance companies, I was talking to Regents and Premier and folks around the country, they're like, oh, we have this pool, we don't want to mess up with this pool by creating all these other people and putting it into a risk pool. I'm like, what are you talking about? I mean, everybody should have an opportunity and be looked at just like everybody else. There's not a greater risk because the notion is, oh, these are poor people coming on the roll. They're not viable candidate for those who are working in corporations. So the notion is looking at them differently and making sure under the Affordable Health Care Act that they're living by the compliance and rules that was set out to be. There's a lot of room for interpretations, but we could guide that interpretation and work with those companies or states and feds to make sure that implementation happen. I can't remember your second question.
Just around the opportunities of the Affordable Care Act and how senior services might access those opportunities and use them to better serve the seniors in our community.
Well, I think it's a great opportunity to work with some of these insurance companies. I mean, I see it both ways, pushing our agenda for the Affordable Health Care Act, but also using them and saying, hey, would you partner with us? They focus on health and well-being, not just for senior adults, but just across the board, but finding out their niche and helping us figure out how to navigate that and leverage that resources to benefit us in terms of the work that we're doing. That would be a great opportunity. A lot of insurance companies are out there wanting to partner and figuring out. They don't have the answers. We should be the driver of that for them. So that would be my answer.
Hello. Hi. Over the last 10 years, this organization has chosen to divest itself of several senior centers. And I'm curious your thoughts on where senior centers lie and the importance of senior services and how to move forward with that.
Well, that's a very tough question. I thought long and hard about it, actually. Senior centers, to be an equivalent, is figuring out the relevant need in that community. Because a lot of senior centers are place-based, okay? So the question becomes, are there aging older adults living in that community? Has the demographics shifted in terms of, is that utilization of that center being utilized to its full capacity? And figuring out how to re-engage, if it's a re-engagement issue, or it's a real question of no one's really taking or coming. Should we do something different? And I would, from my assessment, I would say stepping back and looking at it from an assessment level of data. I'm a data geek. I love data to some degree. It doesn't drive everything, but it's important to look at data in terms of demographic shift, need, utilization, services, programs. So, there are some really great senior centers that are really integrated into the community. They have done a fantastic job of figuring out the needs of that community and integrating it back into the community. The notion is, are those senior centers being used as a model? Are those practices shared? Lessons learned from other senior centers that could be shared across? Can it be implemented in that way? I don't know the answers to those things, but I think those are some of the questions that we need to ask ourselves, whether we reinvest or de-invest. And if we reinvest or de-invest, I think it is a conversation with the community, that it is not a surprise. It is a constant communication aspect of it, so that they know what they need to do, they know what we need to do, and how could we support each other collectively to be successful. Because, I think of senior centers, in some ways, I said this is having its own mini nonprofit. I mean, they got their own board, they have their staff, they have their issues in terms of dynamics of community. How senior services can support that is the question I would ask. How do we support and build those senior centers to make it viable, productive, and moving and in a great shape financially for all of us? So.
Good morning.
Good morning.
Hi, So my question is probably a little bit more personal.
Okay.
What kind of support do you need from the staff other than, doing our jobs?
Mhm.
For you to flourish, and then how do you revive yourself, because the job is very demanding.
Oh, yes.
So what are the kind of things that you do to revive yourself?
Well, I love to read. I love to read. I just love to sit and stare at the sky sometimes, just smell the roses, kind of. Just sit in my backyard and just take it all in. In terms of what do I need from staff, let me answer that question first. I like a workplace that's fun. It's important. We spend probably 8 to 12 hours or more of our lives together. So I want to be a supportive coworker. I want to be one that champion and cheer for you, that understands your pain, your happiness, on that level. Because I am spending more time with you than my husband and kids. And somebody who feels that I can inspire them. I could be there to support them in their work. I see myself as a person of resources to the staff, but I see the staff as someone I need to nurture and help grow. So giving them the skill sets, the tools, the training that they need to blossom in their work. And to really have an open communication, to really talk. I believe in rolling up my sleeve and doing what it takes. I don't see myself as one that's like, oh, they'll get a hand. I set, my philosophy is demonstrate what you want. And so that's kind of my motto. Show folks how I want to be treated, how I should live my life, and what it should be. In terms of just cooking, I love to cook. That relaxes me. For some reason, it does. I think it's because years of just working in policy issues, and you're dealing with a lot of complicated issues. So cooking to me is like follow a recipe, or you see results. I see results right there. Either someone's happy with the meal or not happy with the meal. You'll have it right then and there. And so because the work that we do isn't going to get the results overnight. So for me, I look for a different outlet to get there and then come back to work every day. So.
David?
Yes. Sorry. Yeah, here, we'll let you go next.
I'm curious because I'm sure you're aware that in this city, many of the Asian refugee populations have set up their own parallel systems. So you have Asian Counseling and Referral,
Yes.
Chinese Information Service Center,
Oh, yes.
Nikkei Concerns, and they are robust and they meet a very particular need in the community.
Mm-hmm.
And I'm just wondering how senior services kind of take some opportunity or some
I think
role in linking or creating stronger partnerships with these separate entities.
I think I have a very strong ties to those organizations, just my years of working in the community. But I think it's an opportunity, like you say, to really strengthen the partnership. And, in some ways, to provide that leadership for those organizations. They're needing leaderships around the healthcare issues, around meals, transportations. We could help them and facilitate that partnership with them. Instead of recreating or doing it ourselves, but really talking to them and asking them the question of, what do you need from senior services? How can we be a better partner to you? What are some of the expectations you have for us? How can we meet some of those things? And if we haven't done that, we need to do that. And I think that'll create opportunities for partnership and asking ourselves where we should put our resources. And if we can, it's a really question of, can we? But I think there's great opportunity. And also kind of leading the charge in terms of the advocacy work with some of these organizations. They're looking to us for that leadership and guidance.
I was wondering, you talked about strengthening the board.
Yes.
And you talked about strengthening the board, and I'm wondering about what your thoughts are about how you would work with the board. What would be the ways that you would like to work with individual board members, the executive group of the board?
Well, first of all, I would say, working with the board, figuring out in terms of who's on the board, what are the strengths of the board, in terms of their connections, who they are, figure out their comfort level in fundraising, because not every board's comfortable, and then having those real conversations, because to me, it's getting a board to focus on the need of the organization, and one of those needs is raising money, and having those real conversations, and providing training to the board. Not just saying, oh, you guys need to go out and raise money, but really figuring out with each and every individual board, what is their comfort level? I know at Komen, an example was 3 years ago, we shifted our board to a give and get board. You could come join Komen, but there was no expectation of a certain amount of money raised. We had a whole entire conversation with the board that took about 1.5 years, to the point where they're like, okay, we could do this whole give and get, and set the bar for them and their expectations being clear about with them. And then asking each board member, what will it take? How can we support you? What do you need to help you get there? Does that mean, sometimes it doesn't mean you have to do that. It could be you inviting us to be a friend or a donor, and we'll talk about senior services, the good work that we do, what we're looking forward to, and what opportunity with this donor can exist. And being the bridge for us, not necessarily having to do it if that's the comfort of level that individual board may feel, or if the board member feel very confident that they can do that, giving them the tools and the resources to do so. So that being focused is providing training and support, but also, helping us guide senior services, figuring out the strategic plan and figuring out what are some of our core work that we need to do, what are areas of focus working with the staff that we need to hone in on. Setting policy agenda is another aspect that I love about the board, helping us shape that. Having those conversations, what would it take? How would we get there? What would it look like? So there are many, many opportunities to strengthen the board and figure out their roles and what role they want to play. And also ensuring that we have, like I said at the beginning here, a diversity in terms of community representations, but skill sets. We need certain skill sets on the board, not just who they are in their community that they represent, but the skill sets we need to help guide in our planning, decision-making, and strategic directions. That is an important piece. We want the diversity of voices and skill set at that table that will make us stronger.
I think there's time for maybe one more question.
Right?
There is one more.
Yeah, that's one more.
I've been here 2 years, and soon after I started, I was in a meeting where an employee that had been here much longer said that they hadn't received any type of pay increase in 5 years.
Right.
And it was shared at the meeting that senior services, there was a whole conversation on COLAs versus pay raises. And it was shared that senior services does not give raises. You have to have a change in title or, so they focus on COLA. And that's totally two different things for me. When you talk about retaining staff, what are your thoughts about that?
Oh, I think it's key. I think it's key, but that goes down to performance measures and outcomes. Having clear roles, responsible expectations, and work plan that says, here's what I expect, here's what it needs to be. There needs to be a merit. People need to be rewarded for their good work. We need to build that in if it's a culture that hasn't been in, and I strongly believe in that. I know as an organization, facing cuts, that sometimes we don't get pay raises. I did that last year. I made a recommendation that we didn't give staff raises. And it's a challenging and tough decisions. But for 5 years straight, that can't be. We need to make some changes organizationally to support and keep and retain good folks. Because what it will do to us is it will cost us more. We're going to burn and turn. We're going to constantly have to train and bring people in. And it costs. The value cost is there. I've seen it. So for me, it's looking at that system and making sure we have performance measures, outcomes, creating a merit pool that allows managers, directors to have access and the authority to give their staff And it should be a culture that rewards and values your work and supports you in that way. Not the culture of, we don't get raises, no matter how hard you work. Then why would you be here? You know, you can only do it out of goodness of your own heart for a while, and then you gotta think about your families and what you gotta do. And so, for those who are amazing, we wanna keep you. We wanna keep you. For those who are working on towards amazing, we wanna help you get there. We're providing training and support. You know, but I think it's important to send that message to staff that we care and we value, and this is how we're gonna do it. And whether we 1 year can't give you raises, we have to find other means to be able to show you that we support you and care about you. So, and value you as an employee of this organization. So.
Good job.
Thank you. Oh, okay. Okay,
There are forms in the back if you would like to provide some comments. And looks like Terry's holding them up. And then we'll collect them at the end of the day for those of you who stay the entire time. So, thank you, everybody.